Good morning, Dr. Don.
Good morning.
How are you?
I'm wonderful. Good to see you here.
I'm so excited to be here because, every year it looks like the CDA is coming back to California. Can you share with us your names, your practice, and also we here, the purpose here for today?
So my name is Harris Doan, Dr. Doan. Taught at USC for 40 years, still on the faculty. And we have a wonderful relationship with our practice in Westminster.
Yes.
And this is a wonderful occasion because there are 40,000 dentists here and their assistants. And we get together every year here in Southern California. And I've seen already maybe 15 of my old patients here.
Oh, okay.
Students.
Yeah.
And so anyway, it's a pleasure. Beautiful morning. And so happy to meet you here.
Good, good. Okay, let's go inside and see what's going on. Okay, wow, look, it's so crowded. I heard the first floor is a good place for us to see a lot of equipment. Okay, this is how it's inside look like. I'm gonna turn 360 degrees that way. All right, Dr. Don again. Hello, Dr. Don again.
Yes.
We've been outside a little noisy with music, but at least we come inside and cooler, and a lot of people walking around here. You've been here a little bit earlier, so can you please share with us what do you feel about this year of the CDA?
I think this is the most people they've had ever here. We expect about 40,000 people here, and it's just so crowded inside. But it's a great experience to be here because we have the best clinicians in the world lecturing. We can keep up to date on the very latest things that are happening in dentistry. And we actually, I'm very, very happy with being associated with our clinic because we have the best equipment. We have the finest dentists there. It's a real pleasure.
So how many days for the CDA that normally every year and happen in California, Southern California here?
Yeah, so we have one in Southern California and one in San Francisco. And so people from the northern part of the state can go up there, and then this is the most popular place, so and they come from all over the country to this place. As I said, we probably have 40,000 people this year. It seems like it just blossomed from last year, and it met many more people, and just a dynamic feel here.
So can you estimate how many times have you been in your dentistry, your dental life, dentistry life wisely?
Yeah.
How many years, how many times have you been like for estimate?
I come every year.
Every year. So for how many years now?
40 years.
40 years.
More than that.
Yes.
I've been teaching for 40 years.
This is the legendary Dr. Harris Doan for 40 years, maybe more than that he been into the CDA like this. Well, hopefully we'll bring the camera inside of CDA, inside of where it's on a machine, all the modern machine, and a lot of equipment, and a lot of dentists association, and the dental assistant, like all staff will be inside.
Yeah.
And also the equipment. So we're gonna see it today. Yes.
Great. Well, this is a fun place to be if you're a dentist. You can see the progress that we've made through the years. Dentistry now is totally different. It's painless. All the latest techniques in making crowns and bridges, and we have all of that in our office.
Yes, I believe that every year. Most of last few years that I've been with you, and I feel so exciting. Every year we come up with the industry come up with a new technology,
It does.
a new strategy, new technique. And also, I've been in Asia too, and it's not as big as here today. I'm very exciting too to get inside and see. So we're gonna go inside.
Yeah, let's
show
do
them.
it.
Yeah.
All right.
Glidewell is a big company that we have been using the product at our clinic. In the past, Glidewell has been done a wonderful job. It's right here in Orange County, and our office is right in Orange County as well. So it's very quick for us to be respond, or they sending us product. So please introduce yourself, and I'm going to ask you about the product. You're going to go into introduce to us. So
absolutely, Rob Bernizzi with Glidewell. Happy to be here and share something new with you.
Yes,
we're actually launching it here at the show for the first time officially, which is Bruxer Fusion.
Yes,
which is a aesthetic crown for your patients, but it's the beauty of glass ceramics with the strength of zirconia, which for the patient or you, just twice the strength with the same aesthetics. It's a two-piece crown, patented. There's nothing like it in the world.
It's very special. This is like enamel that we have. We use them, and then this is like a veneer. This new technology is I haven't seen anywhere, and also this is look like a veneer snap-on, but it's not. It's inside. Whereas he mentioned about glass, shiny and look very ecstatic. Look, so please go for it. So
yeah. So to your point, it's literally fused together into one piece.
Right.
You're right. And I know it's probably hard to see.
Yes. There you go.
But beautiful, natural-looking teeth, but stronger than your natural teeth.
Yes, stronger than the product zirconia that we have been talking about. We have using everywhere in Asia and here in the United States also well. But new technology that Glidewell who designed the new product for this year, and I believe that it's gonna be a lot of people are going to try it out, especially. What about the grinding, the thickness and the easy
prep?
break and crack? Yeah, the prep.
Oh yes. So prep is same as you're doing for your zirconia now.
Yes.
But as far as the if a patient's grinding, is that what you're talking about, or worried about cracking?
The prep.
Yeah. Oh yeah. So no, same standard prep that you're doing now for your zirconia essentially.
Oh, I remember this question. So zirconia is heavier product. This one lighter. How much percent lighter?
Oh, in what sense lighter? The
itself, the whole entire unit itself.
Oh.
Or the crown itself. Same.
Yeah,
same
I'd say the same.
Okay.
Yeah, no, great question. I'd say it's the same. It's just two different pieces ultimately creating one. So I think it's the same.
What about a machine that you put on? What is the temperature? Do you kind of estimate the temperature and the length of this put in the oven to delivery?
Yeah, so this goes through a process that's fired, to your point, heated, fired for several hours.
Okay.
In 1,000 degrees of temperature. Like it's a very long process to create something like this.
To make a good product.
Yeah, absolutely. It takes a lot of time and energy to create something like this, but that's all done for you and your patient.
Yes. So last question is that the cost. Patient always worry about the cost, right? So I know you come to the dental office. You always say, "Hey, what is the price do I have?" Good product, but the price.
Yeah. So it is our price for you.
The price for us and patient. For us, it come down to patient, right?
Yes.
Yeah.
Yeah. So
it's cheaper.
Oh yes. This to get something like this from one of we'll say the high-end aesthetic labs is going to cost twice as much. So as you know, we're always trying to keep the price as low as we can for you, so it can be more accessible to your patient. So yeah, you'll get the best restoration available, but at a better price than you would get from somewhere else, which means you can pass that along to your patients.
Yes. You know, there's so many labs in the community in anywhere, right? Like we're very big, but the price they always control down to where it's a dental office or clinic like us. We can try to search for the good product and also a good quality product, so in that way we can bring it to you. So I'm very glad that I here seeing you, Mr. Robert, and I hope that we're gonna continue doing our visit at our office and to your product.
Absolutely.
All our doctor and dentists, like they always refer to your lab. So we just write the slip and send to your lab because the product that we know that they stand by their product.
Yeah, like you said, made right here in Orange County.
We have no problem at all.
Yeah.
So thank you
so
very
absolutely.
much.
Thank you so much.
Ở đây sau lưng của mình là Paul, một cái software công ty AI, thì mình sẽ hỏi những anh này coi cái gì mà tốt nhất cho cái AI industry mà ở trong cái dentistry nha. Okay. Question again. This is benefit to patient and also doctors, dentists. So but who is more like convinced, more in this kind of AI?
So this is obviously being purchased by the doctor. doctors because they're installing this into their system so they can present to patients. We have patients calling Pearl all the time that are asking, where can I go to a dentist office that utilizes Pearl to show me what my x-rays look like?
I see.
Okay, so it is a benefit on both sides. First of all, disease detection, super important that we're finding everything within the teeth. It helps us on a liability standpoint as well, because now we're seeing everything. There's stuff that's not being missed, and we're bringing that up to the dentist. Now, dentist goes in and diagnoses off of that, right? It's not always 100% accurate, but it does direct them. It gives them a roadmap into where we're looking in the teeth. So a lot quicker diagnosing and a lot more efficient in a practice utilizing this.
So who are our competitor on this AI thing?
Yeah, our competitor's Overjet is probably one of our biggest
Overjet?
competitors.
Okay.
There's one called Overjet, and then that's probably one of our largest competitors out there. Different things between us and Overjet is we actually highlight over the cavities, show you a percentage of how that breaks down. When we show you the anatomy, we show the dentin and the cementum. They're going to show the enamel and just the pulp. We're FDA cleared, so in the United States, it's a really big topic is FDA clearance.
Yes.
Not so much outside of the country, but there's a lot of other things that Pearl is actually offering outside of just the United States that you'll see different things that's within the system that we can utilize as well.
Last question: What is the next move of the Pearl? Because Pearl is leading in this industry.
Yep.
What is the next?
Love that 3D scanners. So
Ooh.
CBCT, that's already in for FDA clearance. So we're going to start seeing 3D. We're also going to be using a tool called Scribe. So anytime you speak to your patient, we're going to auto break that down and put it in your practice management system for you. So now you don't have to go chart near as much. It's going to be automatic. It's going to drop into there. So perio charting, super helpful on that side. It's really quick for that side.
So hopefully in the future, our insurance company will accept more on our end, and then that way is helping the dentist or the dental office to make sure on the money side, financial side, easier.
Exactly.
Job right now it's a little difficult between the insurance.
Yep. So we're able to combat the insurance company because insurance companies utilizing AI to actually look at your claims. We're able to combat the AI. I call it fighting fire with fire. We're using our AI tool to combat their AI tool and get you a higher acceptance rate.
Okay. Well, thank you so very much for your info, and wish the best for Pearl, and we love it.
Thank you so much.
Thank you.
Enjoy, guys.
Day.
Have a good show.
At Hoover company, and this is equipment that we using at our office, and we like to ask a gentleman who from Hoover, he know more than I do, and we got a lot of new equipment. And please introduce yourself, sir.
Hey, this is Ken from Hoover, LA, Central LA branch. It's my first time doing this, but then I'll do my best.
You do better than me now. So anyway, can you introduce me about the K3, K5? What is it different with the one I had, or the new stuff that people love to have?
Well, first of all, K3 has a greatest slogan saying "simply yet sophisticated." So pretty much everything is included in this. Yuri is the electric handpiece that the dental office can offer. Let's say a lot of the dental chair out there, they only have the air handpiece, and this electric handpiece, it works slow. However, it controls the speed, so it's definitely gonna help doctors working on something that has to be very detailed. Because air is you shoot it and it runs at like so high speed, it grinds everything. But this one, as you can see, it goes up to 40,000, goes down to 1,000 RPM, round per minute. So meaning that doctors can have a very good control on their hands regarding the detailed parts.
Okay. So for the color, and look at this time, it's more luxury, high end. Is that every year we change a different color, and we try to make it look different, especially internal already changed. But the color also.
Color, if you change, I've never done that, but then it'll be costing extra monies. But then if something goes wrong, then we can always change that.
So between this one and this one, the new model, is there any different? This is a model of
So this is our newest model.
Yeah.
Pretty much all the concept we have is the same, but then look at the design of the delivery unit. This is the future of
wow. This feature is a touch screen,
Yes, it's touch
not the
screen.
button, because sometimes the button it can be sensitive, but
Yeah,
this
yeah.
one is more like don't have to
More
control on the
controls
click.
in hand.
Right.
And pretty much the layout is same, 2 air, 1 high speed. Main different thing is it's now wireless pedal.
Oh, the paddle
This
is
is
different.
wireless.
Okay. Yeah, I like
And
that.
then-
This screen is much better. This
Yeah,
looking.
it's bigger than that.
Yeah.
The main difference is that there's a built-in water purifier.
Okay.
So whatever the water coming out from the chair to the patient's mouth, it's all purified again.
I love this one already. I think we better get another 5 or 6 of them again this year. Moving on, the next one I want to introduce. I think this is so luxury. It's like a car, you know, like a racing car. So
Yeah.
please share with us. What is it here?
This brings another level to a dentist where they can expand their treatment plans to implant or full arch solutions, or even better. So what it does is that it's taking multiple X-rays, like about 500 shots of X-rays, and combine those into one 3D model, which you can see from the program. We can basically see what's going on with the patient's mouth in 3D model, so we can give more accurate diagnosis to the patient. And this only takes 10 seconds to scan.
10 seconds.
Yes.
Yeah.
Other competitor brands, they take about like 20 to 30 seconds, and it offers 15 by 15, which means is that instead of the patient taking multiple shots for each arch, we can just take one shot at once.
One question: when patient or when staff that working on this machine, they understand the X-ray. So can you share the radiation? People worry about radiation so much. What is the limitation, or
Okay.
what is the less radiation because of new technology?
So it's shown here. When you travel to East Asian countries like that, the exposure of the radiation is this much, about 3.1. But then, like, just taking one CT, it's 100 times less than taking planes round trip. So
Okay. Wow.
What do you say?
I heard a long time ago the different machine is only about 1 up to 10 times, so less than 10. One time you go into the sun, this is like 10 times less.
as the
So then-
technology evolves, it gets much lower.
Right.
and
Now it's
still
lower.
providing very accurate image quality.
Right. Yeah. So.
So this is the modern dental industry.
So this is the reason why the new technology is involved in helping patients to have more accurate, to dentists to be more accurate. Yes. So I'm very happy that you all have a new equipment, and I hope that in the future we good. So thank you so much for your
pleasure.
time today, and I hope you viewer you see what's going on. Hello, so my name is Tim Do.
How are you, Tim?
And I heard about Danny a lot. Good names, good technology, and a new way of doing denture. So can you please share with us what is Dandy has been improved?
Yeah, sure. I'm Robert from Dandy. We have a tremendous workflow for dentures, right? It's usually can be completed in 3 appointments for a full over full, unless it's an immediate denture, we can do it 2 appointments, and we can make a copy denture in 2 appointments. We use Lucitone 199 for our dentures, so it's a very well-known name and well-known material. And
so,
we have workflows for all of these.
so how long have you designed, or your company designed this new cut down?
This workflow?
Cut down, yeah, the workflow.
It's been in the making for a while, but we've been successful with it for well over a year.
So from beginning, the old school, that we get impression and we do the stone and we send them out to the lab, and then lab come back, and then doctor will try it on the sap,
The bite ring.
the bite ring, and then send them back to the lab, and then send it back and forth many times, and every time we send, it can be misalignment,
Mistake, yeah.
mistake. Every time, every more step we do is not good. But Danny has been. Can you tell us the process?
Yeah, we've been very successful with a 3-step full over full, right? We have a very specific workflow for that. The first one is scanning your patient edentulous arch.
Scanning.
Yeah.
By scanning intraoral, or do you read impression as well, or just
No impression.
No impression, oh.
Scan it. It's all done by scanning. It's all
Okay.
digital. Excuse me.
So you scanning, and then from the office of the dentist, we scan them and send to Danny, and then Danny will come up with the
With the bite rim, our own proprietary bite rim that you'll receive in about 3 or 4 days.
Okay.
You use the bite rim the same way that you do. There's a couple of things that we change in the workflow that we explain.
So when the bite ring come to us, how do we put on patient to make sure the bite is good? Is that already printed out?
You treat it like a traditional bite rim.
Okay.
We have a couple of tips and tricks that we show them during our training.
Okay.
And then the third appointment, you're going to receive a final denture. And 95% of the time, it's perfect.
Oh, okay. So when we send it to you, you're gonna send us the final, and then we just put on the patient.
Exactly.
And that can be a regular dental, and also the
An
what's it
immediate-
called?
an immediate-
Intermediate load, like a on X.
No, all on X. Just
Oh,
a
not
dent-
yet?
Just a denture.
Just
yeah.
a dental.
Yeah.
I see.
Yeah.
So eventually, hopefully, it's going to be on X.
Eventually, I'm sure we're going to be there. Just
Yeah.
a matter of time. We're trying to digitize the entire process.
But at least now we cut down to three process, so that way.
You could start a denture case on the first day of the month, and you could finish it before the 15th or the 20th of the month.
My patient is flying all over the place to California, and then we cannot keep them in California so long. They have to go home. But in order to do that, then he have a new way of doing things that patient can come in and out as quick as
Very
they can,
quickly.
so they can go home, get back to the job, or be with family.
Right,
So,
right.
Thank you very much. Thank you, sir, for
No, thank
your
you.
information. Hello, everyone. Again, this is the station that we like to come here and ask some information from beginning. But anyway, we meet a gentleman who handle a lot equipment in Orange County for 2025. Can you please introduce yourself, and to 2025, what is the best new equipment that you introduced to our community?
Yes.
Hi, my name is Larry, and I am the Vice President of U.S. Dental, and we serve all over the United States. We are based over here in Southern California, near Anaheim, and one of the best technologies that we are pushing now is all the next type cases and technology. So we have photogrammetry scanners, we have intraoral scanners where you can combine those two and do same day immediate loaded all the next prosthesis. And so that's been changing a lot of our doctors' practices. And so the combination of CBCT, 3D printer, intraoral scanner, all those technology coming together, you can get your patient with an all-in-next hybrid prosthesis without conversion, same day. So we're super excited, and we helped doctor restore about 1,000 cases, and all were very, very passive fitting. So we're super excited to continue this road to share our experience and our expertise here at US Dental.
Yes, he and his company is that trying to give a solution for many dental office or clinic due to a lot of different design out there, a lot of equipment, a lot of instrument out there, but the dentist has been busy, the clinic has been busy, and no one know what is this, work with this. So there's so many intraoral, intrascan, and the 3D panel, and many more product with the new stuff that's scanning on the face, smile design. That there's so many, but this company, US Dental, has bring in the value of connect every one of them, and especially in the past year, I have been learning my experience, my knowledge in dentistry is through US Dental. They invite the best doctor in the United States to bring in the value and try to share information. So please tell me this year, here I see so much of difference. So this is the scan.
Yep. So this one is a facial scanner.
Yeah.
To do a 3D facial scan.
Okay.
Why is there value with a product like this? Is for doctors that have a patient that needs denture or even all in X. This helps you get the midline and the occlusal plane in the right position without the canting and the protrusion of the prosthesis.
Yeah.
Then you have your portable X-rays.
This one, I think I'm gonna take his job right now because you know why? I'm using this. And compared to other dental office, they may use the arm. So right here, it takes time to walk to the side to press the button. I have two arms. I did not use still in the office, but this one is more convenient for the dental assistant. This is female, more female. This is so light. It's so sensitive. Take pictures and get your pictures right away. So they update with all the best equipment for the dental office. So I'm highly recommend this Vortex. Love it. Next time, I think I'm gonna buy this one. There you go. So this, what is it? What is it?
Yeah. So over here, these are photogrammetry flags. So let me go ahead and open that for you. And you're going to use it in a combination of an intraoral scanner from Shining 3D. This is mainly for people that are doing a lot of all-in-X case. We have a solution now where you can intraoral scan, pre-op scan, down to the photogrammetry, so that you can have all the information together at one time sent to the lab. Instead of having a different device scanning photogrammetry or intraoral scan, you have it all in one together. And we've been using this a lot, and we've done a lot of testing to make sure that these cases are successfil and very, very smooth for the doctor's experience, especially doing a case like that you can see on the screen.
There you go. This is a screen at your gum line where is the extraction is out and the gum line is kind of sewing back and make it look so healing. This is the sensor that technology bring in the bite. The bite is gonna be really designed and really the bite. Both of the bite is going to be fit on perfect. That not really require a patient to fly back and forth visiting office many times because of this design. So the one I just shared with you, this is going to be the good stuff that are coming up last year or this year. The scan, what is that? The scan, the small one.
So this one is the first generation.
Oh, the first generation.
And this one is the wireless.
I see.
This one is still really, really good. Very affordable price. And this one is the newest iteration that they just come out with this year.
So this one we have the Matic before, but now this one I believe the saliva and other stuff that it cannot scanning before but
this
one is that good?
So this one is much better now. It can scan in even bloody fields, especially for doctors that are doing all in X. Scanning soft tissue is very hard in a lot of scanners. Doing it with the Shining 3D makes it so much more easier and makes it more flowing, quicker for the assistant to scan, so that you don't have to worry about bloody fields or saliva and being dry. You can do it with the scanner now, which is awesome.
The best thing I like to share is that because of technology, it's quick, it's fast, and it's accurate. So then that way, patient won't be open their mouth or your mouth and bleeding and hurting. The time length enough for you to open your jaw. You're not happy, you're not comfortable. But this stuff is make it quicker and faster and helping the dentist to easier job. So the technology is helping us a lot.
Absolutely.
Is there any AI related hardware or software this year that you like to share?
So this has all of these scanners here has AI built in them. So for example, the Trios 5, very popular, very well-known brand, one of the top scanners in the market, has AI engine built in it, meaning that even a person with no intraoral scanning experience can pick it up and scan inside the mouth, no problem. That easy is amazing, and we have assistant now scanning the full arch in less than 30 seconds. Is how fast they can scan. And so, a funny story, I was training in a doctor's office, and there was a assistant that was 68 years old, and she wasn't willing to do any intraoral scanning. I gave it to her without any training. I said, just scan in the mouth and see what happens. With the AI engine, it helped her capture it under 1 minute, and so she never uses impression material again. And she's been doing impression for 30 years. So she's never going to leave the scanner ever again. So that's
if you have experience in impression, then you understand the bleeding or hurt, it's painful when you do the extraction, but without impression and you use only scanning and it can give you an image from the blood or from saliva. It's beautiful technology that helping your patient's life a lot. And they be happy, comfortable, they can come back to you again, or otherwise they will be gone to other office. So this is technology and we love to hear and to share with the community or patient out there. That's why we are here in the city every year. We try to learn how much we can. But thank you so much, Mr. Larry, for sharing the community or teaching dental office out there, new technology, what it is about. And well, thank you very much for your time.
I appreciate your time. Thank you so much.
Thank you. So this year, 2025, we have a lot of AI software, AI technology that involved into dentistry. And here we have gentlemen, please introduce yourself, sir.
Yeah, I'm Peter. I'm the founder of Dentina AI. I'm also a dentist. Dentina AI is an AI receptionist for dentists. We offer services to, enable scheduling 24/7, day or night, directly into the practice management software. It's great for patients because they want to get an appointment Monday morning, Sunday night they call. Sometimes it goes straight to voicemail or they just can't get on the schedule. They can talk to Dentina, a human-like AI, and get on the schedule that day if they want to.
So can you please share with us, because the old tradition that what we have right now, we have like 10 receptionists for a patient calling different country, calling in. We have patient on different country, different time zone, but this AI will help them to answer anytime. So this more effectively. But is there any different that you see that improve compared to custom, receptionist?
Yeah, so we find it to be, number one, very complementary. Dentina is able to predictably, reliably handle scheduling new patients, scheduling existing patients for recalls, scheduling emergencies, scheduling consultations. The staff, the human staff, is where they're going to step in is going to be scheduling treatments, where it can be sometimes a little complicated to know how long the appointment is, or with which doctor. Or there's issues like billing questions that also need that human touch. So Dentina enables an office to allow their people to focus on high priority things, important things, unique situations, and let Dentina handle the more routine types of calls.
Talking about this, is there any integration between this phone, like a regular phone line, to the software, the management that we use? Like we use EagleSoft from the beginning, and then now we use Idensoft. So are there any integration at all, or it's just separate the system itself?
So we integrate with any phone system. Because we use Dentina uses call forwarding. So any phone system that allows for call forwarding, which is all of them, we integrate with. We integrate with all the major practice management softwares like EagleSoft, Dentrix, Open Dental, Dentrix Ascend, Denticon, Curve, and
name it, right?
A couple of other ones. Yeah, exactly.
Okay, so the conversation between AI and patient calling in, is there any hiccup, or is there anything texting also? Is there any of that feature including or only over the phone?
So we do have texting.
Okay.
Basically, Dentina can follow up when a patient calls.
Is that automatic?
It's automatic.
Oh wow.
If a patient calls and does not schedule an appointment, Dentina can follow up and just let them know, hey, if you need, we can also continue the conversation by text if that's easier for you. And so they can schedule either via voice or text as well.
Oh, awesome. How many language that are we offer right now? Because I know English is for sure in America.
So English and Spanish comes in all of our plans.
Okay.
Our premium plans come with additional languages.
How many more language?
It's an additional 6 languages that are possible.
Okay.
And then we do have, in 3 weeks we'll be unveiling an additional 22 languages on top of that.
Oh, I hope there is a Vietnamese because our patient is like 95% is Vietnamese.
I want to say that we will. I'll have to double check on that for you, honestly. But I believe that will be available in the next 3 weeks or so.
I'm so excited. I hope that it can help us to do the management on the call because right now it's chaos for me to have missed call or to have some kind of follow up with patient. So that way, I love the new idea. So I appreciate you coming out here with this product, and I hope you out there as a patient or as a viewer, you will see a new technology is offering right now, and all the dental office that apply with the new technology that is helping our life easier and more accurate and more efficient. So thank you very much.
Thanks very much.
And we just came from the other station, and now who we seeing here, the lady, beautiful lady on the phone only. We work with her on the phone only. We have been how many months? We switched from other management software, from EagleSoft, from other stuff, but now we are with DentalSoft. And the lady who represent here, I'd like you to meet her, and she can please introduce herself.
Yes. So I'm Frankie Pasillo. I'm the sales rep here at iDentalSoft. Been with the company for 7 years. And yes, I've worked with this office. Absolutely love them.
So we very exciting when we switch over iDentalSoft, and the company is not too marketing out there, not too big like other company, because other company has been long in service.
Yes. So we definitely rely on word of mouth.
Yes, but we are switching from other company to this iDentalSoft. That means they are very good. And can you share on the database, on the security, why we are so special?
Yeah, so with iDentalSoft, so first we're hosted through AWS, which is Amazon Web Services. So we host all of your data for you. So we do the backup, the security, the encryption. And then with that, it is a full cloud-based system. So all practice management services are built into the subscription of the software. So you don't have to work with as many third-party vendors, which limits the security risk as well.
I understand that you are leading industry of the software management. They have a logo inside of the software called AI. It's artificial intelligence. So please share with us what is the special new of that.
Yeah, so with the AI integration with the X-ray software, you're able to click on any image, and it's going to color code your image for diagnosis purposes. So it's going to give you a legend and tell you if the patient has potential caries or infection, bone loss. All of it will show up in that AI, and it's really helpful to explain it to a patient. When you put two images side by side, you can show one X-ray that is not AI and one that is, so the patient can see exactly what their diagnosis is.
So what is the new project? Because I see that we are leading on that.
Yes.
So what is a new project that you think that in the future that in software management can apply or can see that it can be help patient more?
Yeah, so one tool that we're developing right now, it's actually developed for the CDA, is a 3D odontogram. So one request that we've been getting is offices want to be able to click on a tooth and see all treatment involved with that tooth. So we have that now within 3D odontogram. So the patient can see very clearly what treatments they have had completed, what treatments are pending in their mouth, and you can see exactly the full history of what's taken place for that patient in one place.
One more thing that we love as the clinic, we understand the software is very helpful from the picture, from the treatment plan, we gather a package and we send them to the insurance company. Thumbs up, the company, where is they doing that too. So then it helped us a lot for management itself in the past year.
Yes.
So we're very happy that we are working with your software company, and I hope that in the future there is the 3D that you mentioned. You can help patients more. So here you go, the iDentalSoft, and thank you so much for your information.
Thank you so much. This has been wonderful.
Yes.
So this is our brand new Curing Life. Yeah.
So lady, she's on this section. She's gonna introduce us the new stuff here. Those kind of what is new this year?
So this year we have our brand new Curing Light. It retails for $5.99. Our show special is $4.99, and we give you a $200 voucher to take a course.
Okay.
So essentially, you're getting it at a very good price. It does have a 1-second curing capability. It does have a 360 rotating head, and it does have a built-in light meter. So it has 7 modes. So when you turn this on and it's plugged in and you put it right here, it'll tell you the meter. Yeah.
Wow.
Most curing lights, this you have to buy the meter separate. This is all in one.
Okay.
It does have a 2-year warranty, and it has a 7 operating modes. It's a very good light, and the price point is good because most of these lights run for about $1,900.
Yeah, I can see. So this one, when dentist normally doing your filling,
Yes.
and the composite in there, we use this light to put it on right there on top of the composite, and make sure the composite is strong as like a zirconia,
Yes.
like your real teeth. So this is the light is small, but it's very powerful, baby. There you go. Oh, there you go. That took
Yes, it
All
really
right.
is, yes. Yesterday we were testing it. We put some of the our
that's
cement in here, and we were curing it with the light, and it was curing very quickly. Yeah. So we were just testing it with one of the doctors.
Yeah.
The
So
light
scan-
output is also really good on that.
Yeah.
unit also.
Well, thank you very much
You're
for
very
your
welcome.
information.
Absolutely.
We love Blackwell. We have been using Blackwell.
Thank you.
And
We appreciate
you know,
your
she
business.
represents for Blackwell. Her boss to pay her more because her smile. Look at her smile,
Yes.
right? Okay. Thank you.
Thank you guys.
We'll see you.
Enjoy.